Friends, welcome to Happy Nursing. This is Ila. Today we will discuss about Freud's psychoanalytic theory. Psychoanalytic theory, or the theory of psychosocial development, describes human development from the perspectives of personality, thinking and behavior. These behaviors include certain drives, desires, urges and motives, which occur in a number of stages and approach in a sequence. The first person to propose a structured theory of psychosocial development was Sigmund Freud. The 5 stages of development proposed by him were oral stage, anal stage, phallic stage, latency stage and genital stage. The oral stage is considered starting from birth till 12 to 18 months. After a baby is born, the first thing he does to survive is breastfeeding. He does that through sucking, which gives him satisfaction. So, it not only becomes vital for his life, but also gives him pleasure. Mouth is the organ through which he makes contact with the mother's breast for the first time, and that gives him pleasure. So, mouth becomes the all-absorbing organ of pleasure for the newborn, the first erogenous zone. That is why whenever they are not breastfeeding, often they try to satisfy their oral needs by thumb sucking or putting several objects into their mouths, such as dolls, toys, small particles, etc. Around 12 to 18 months, the child realizes that the parent who was giving him this oral satisfaction is an entity totally separate from himself, and he cannot cling to this behavior. In some cases, where the mother suffers from any illness and is unable to give breast milk to the baby, or in cases of social problems like broken home or any psychological problem where the mother cannot attach with the baby, problems regarding development may occur in the baby. Weaning too early or too late may result the infant failing to resolve the emotional conflicts of oral stage, and this may cause oral fixation. If the infant is neglected or overprotected, in this case overfed, that may also cause oral stage fixation. That may cause the child to become a psychologically dependent person, or a person who manipulates others to fulfill their needs, rather than being matured or mentally independent. Oral stage fixation can also cause other manifestations like talkativeness, continual oral stimulus like eating or chewing objects, smoking and alcoholism, etc. Anal stage starts from 12 to 18 months and continues till 3 years. In the oral stage, the focus of pleasure was the mouth. In this stage, as it's very evident from the name, the focus of pleasure shifts to the anal zone. According to Freud, anus is the primary erogenous zone, that means which is sensitive to sexual stimulation, and pleasure is derived from controlling bladder and bowel movement. Around this age, toilet training is given to a child, and Freud believed that the libido or sexual desire was mainly focused on controlling the bladder and bowel movements. The anal stage coincides with the start of the child's ability to control their anal sphincter. A parent should give positive reinforcement to the child for using the toilet properly to help him go successfully through this stage. If the children during this stage can overcome the conflict, it will result in a sense of accomplishment and independence, whereas a fixation at this stage can result in a personality that is too rigid or one that is too disordered. If the parents are too forceful or harsh in training the child to control their own bowel movements, the child may react by retaining their bowel movements. They will form into an adult who is mostly stubborn, hates mess and is obsessively tidy and punctual. This is known as anti-retentive personality. On the other hand, parents who are overly passive and neglectful in teaching the child to control their own bowel movements may experience their child relieving themselves at inappropriate times and soiling their pants. As adults, they can be messy, disorganized, rebellious and inconsiderate of others' feelings. This is called anal-expulsive personality. The anal stage is also about controlling behaviors and urges. A child needs to learn certain boundaries when he or she is young, so that in the future they have a proper understanding about overstepping the boundaries. The third stage is phallic stage, which lasts from 3 to 6 years of age. Here the genital organs become the erogenous zone. It is during this stage that the child becomes aware of his or her own body, the bodies of other children and the bodies of their parents. They satisfy their physical curiosity by undressing and exploring each other. They learn the physical differences between the male and female sexes and their associated social roles. This is the time when the child fantasizes about the parent of opposite sex as his or her first love interest. Boys become more attached to their mothers, known as Oedipus complex, and girls to their fathers, which is known as Electra complex. The boy presents with jealousy and emotional rivalry against his father, but remains fearful of his father because his ego is aware that his father is stronger than him. This is called fear of castration or castration anxiety. Similarly, a girl becomes aware of the absence of penis in her body and develops penis envy towards all males. At the end of this stage, the boy diminishes his castration anxiety because according to Freud's theory, likeness to father protects him from father's anger, and the girl unites with her mother. She understands that both of them are females, neither of them possesses a penis, and thus are not enemy of each other. An unresolved fixation in the phallic stage could lead to egoism, low self-esteem, shyness, worthlessness, females who have multiple short-term relationships, or men that treat women with disrespect. Next one is latency stage, which lasts from 6 years to 12 years of age. Freud believed that the sexual urges from the earlier phallic stage are channeled into productive activities. Those are socially acceptable in this stage. The latency phase actually originates at the end of phallic stage, when the child's Oedipus or Electra complex begins to dissolve. The child realizes that their wishes and longings for the parent of the opposite sex cannot be fulfilled. As a result, they start to identify with parent of the same sex, and the desire is transferred from parents to friends of the same sex. Here the child puts his energy and effort to make an accomplishment in the academic field, social relationships, developing new skills, and acquiring new knowledge. According to Freud, unresolved conflicts or issues during this stage can lead to problems later on. For example, if a child fails to make strong social connections or falls behind academically during this stage, they may struggle with feelings of inadequacy, insecurity, and social isolation in adulthood. This stage ends with the onset of puberty, when sexual urges resurface again. The last stage is genital stage, which starts from puberty and continues through adulthood. It is considered as the highest level of maturity. During this stage, earlier sexual urges reawaken and are directed to an individual outside the family circle. This period marks the onset of romantic and sexual emotions, leading to the formation of intimate relationships. For example, having a crush on a peer. The teenager might experience emotional ups and downs as they go through these new feelings and relationships. These feelings may lead to their first romantic relationship, and they learn not only about sexual attraction but also about sexual education, importance of consent and safe sex, and forming meaningful emotional bonds with others. According to Freud, if individuals have unresolved conflicts or issues during this stage, it can lead to problems such as sexual dysfunction, difficulties forming healthy relationships, or other emotional problems. Now, everyone in this world faces some amount of criticism. So did Dr. Freud. Some of his critics said that he based his analysis totally on biological factors and ignored the cultural influence and factors related to experiences. Other critics think that some of the concepts given by Freud, like Oedipus and Electra complex, are not applicable worldwide in all cultures. Some modern day psychoanalysts believe that the role of conscious thought is much greater in affecting human personality rather than what Freud imagined. So today we have learnt about the 5 stages of life through which human beings develop their behaviors. Firstly, oral stage, secondly, anal stage, thirdly, phallic stage, fourth, latency stage, and lastly, genital stage. We will further discuss other psychosocial theories in our successive classes. If you like this video, please like and share this video and subscribe my channel. Thank you for watching.